Can you talk to me about high blood pressure? That is hypertension.
Okay, welcome to today's teachings. Today we are going to look at hypertension, also known as high blood pressure, as part of the cardiovascular diseases. First of all, hypertension is a global medical emergency that is affecting both the young, the, the middle age, the old, and the very old. It's actually known as a killer disease because of its mode of operation. Now, hypertension is a situation where there is an elevation in arterial blood pressure um, of over 140 millimeter of mercury. It's actually measured in millimeter of mercury. So um, above, that is in systolic, then above 100, above 90 millimeter of mercury in diastolic over a consecutive sphygmomanometer readings. So it's not something that you just do once. You have to do again to confirm it. And there's a way you do this. A patient cannot just walk in and you just, or a client just walk in and you just check it. You have to allow this person to settle down, to calm down, for you to get a good reading. You have to do it consecutively to arrive at a better reading. So now, hypertension, hypertension has three types. It has two types. There are two types of hypertension: primary hypertension and secondary hypertension. But we'll come to that. But it's important for me to tell you about this, that hypertension has no known cause or causes, hence it is idiopathic. However, it has some predisposing factors such as age. Something that has to do with age comes, another factor is diet. Another factor to look at is genetic predispositions, because there are some people that it is the sickness or the disease that runs in their families. Then you are also have talk about some drugs, some non-steroidal anti-inflammatory medications. Abuse of such drugs can also trigger or raise blood pressure. Now, plus other factors that we'll talk about. Then, now let's talk about the primary hypertension. Primary hypertension is the most commonly diagnosed among the population. It has no main causes. However, it has some predisposing factors, like just we said, like age, gene, I earlier told you that there are some people that it runs in their families, and also dietary system and lifestyle choices, such as alcoholism, smoking, chronic smoking, and sedentary lifestyle, such as physical and also physical overactivity and underactivities. Now, secondary hypertension. Secondary hypertension is the type of hypertension that comes as a result of complications from other diseases, such as diabetes mellitus, such as liver cirrhosis, such as Cushing syndrome, such as renal diseases. However, there are also other types of hypertension that we need to talk about, like systolic hypertension. Is a situation whereby only the up one, the systolic, meaning the up one in the sphygmomanometer reading, the up one is elevated with moderately or normal diastolic. So what this means is that when you are checking the hypertension here, only the systolic, the up one, is increased or elevated. Let's say about 160 and above to 200, with the diastolic being normal like 80 to 90. Then you have the diastolic hypertension. It's a situation where just the opposite of the systolic hypertension. The situation whereby only the diastolic is elevated. The diastolic is elevated from 100, 90, 100, 110, 120, 130, 140, with the systolic being moderately or normal, 120 to 130 and 140. Then you have another one called systolic or malignant hypertension. This is the most complicated and severe type of hypertension. It's a situation whereby there is a situation where there is a spike in both the diastolic and systolic. Situation whereby the systolic reading is about 160 to 200, and the diastolic is about 120 to 140. So it's a complicated situation, and it's very, very common with patients in patients with cerebral vessel rupture. You know, when we talk about cerebral vessel rupture, we are talking about blood. We are talking about stroke, complications such as stroke, and also it normally has to do with vessel rupture, the vessels supplying blood to the brain and the heart. You know, when there is a rupture, when these vessels rupture as a result of aneurysm, as a result of ballooning of these vessels, blood vessels, they rupture, and that is where you see patients bring blood coming out from patients' eyes, from patients' nose, from patients' mouth, from patients' ears, as a result of this incident causing cerebrovascular accident, or in most cases, myocardial infarction, heart attack. So we are going to look up to next. In our next video, we are going to look at we are going to take one after the other the causes of hypertension, the management of hypertension, both medical, pharmacological, and non-pharmacological management of hypertension. We are going to also look at prevention of hypertension. We are also going to look at the drugs used in the management of hypertension, such as the beta blockers, like the calcium channel blockers. We are going to look at those that are titrated, when to titrate, and how to manage and prevent this disease. Is actually a topic worthy of mention, because it is really killing a lot of people. Many people don't know that they have hypertension. Many people are not even aware. Many people don't even check their high blood pressure. Where in essence, every adult is supposed to be checking their blood pressure at least once in a week, for those that have not been diagnosed of hypertension. But those that are hypertensive patients, that are supposed to be checking, close monitoring of their vitals, of their blood pressure is encouraged, to enable prompt medical treatment and good health. So until we see again, good prognosis or better prognosis. So until we see again, thank you so much.